Hello again, I'm Craig Adams from AM 930 WEOL Radio, and this is First Response, a project of the Alcohol and Drug Addiction Services Board. Today we have Lorain County Health Commissioner Dave Koval and Lorain County Public Health Nursing Supervisor Pam Weiland. Thank you for joining us today, and let's begin with something called Project Dawn. What is Project Dawn?
Well, Project Dawn, it stands for Deaths Avoided with Naloxone. And so Project Dawn is actually an opportunity for us to get naloxone, or Narcan as it's called, in the hands of police officers, and then also in the hands of individuals from individual families that may have a problem in their family with someone with addiction. Narcan actually is an opportunity to bring someone back from an overdose so that they can get into treatment and get cured from this horrible epidemic that we're in.
Can you tell us how it works? How does it bring somebody back?
So if you spray naloxone in the nasal passages, it actually will counteract basically how the opioid is acting to suppress your breathing.
What if you were to give it to someone, you think maybe they have an overdose, maybe that's not their problem though, but you administer that, is that okay?
That's the one piece of naloxone or Narcan that's really great, is that even if you are not experiencing an overdose, Narcan will not hurt you. So if you spray it in the nose of someone that you feel is having an overdose, there won't be any negative effect.
Does this only apply to opioids or no, in terms of overdoses?
It does. Naloxone only has one purpose, and that purpose is an antidote to reverse an opioid overdose. If you give Narcan, it's also called Narcan, if you give it to somebody who's experiencing an overdose from a non-opioid medication, it will have no effect.
If you're one of those people who notices someone having a problem, what are some of the signs that might indicate, yeah, this is an overdose?
Signs and symptoms of an overdose would be somebody who is non-responsive. They could be turning blue. They actually almost look like somebody who's having a cardiac arrest. They're non-responsive, turning blue. Those are pretty much the signs and symptoms of an overdose.
Let's say
and
you
especially
do.
if
oh,
you,
I'm sorry.
especially if you see some drug paraphernalia by them, or you see an opioid prescription that's by them, then you can assume that that's a suspected overdose from an opioid.
Let's say you do have Narcan and you choose to administer that. Do you need any special training? How much do you administer? How often? When do you call 911?
Yeah, with our Project Dawn clinic at Lorain County Public Health, we have a training session that participants will come in. They'll learn how to administer naloxone at that point. Our Project Dawn clinic is a clinic it's a community-based overdose education and naloxone distribution clinic. And when the participants come in, they learn the signs and symptoms of an overdose. They learn the importance of calling 911. They learn the importance of doing rescue breathing, and then they also learn how to administer the naloxone. In our Project Dawn kits, our naloxone kits, it comes with 2 doses of Narcan, a face shield, a DVD for instructions, and some resources. And with the Narcan, if you find somebody that's down and it's a suspected overdose, you'll take 1 dose of the Narcan out, open it up, and it's like a Flonase. It's a nasal spray, and you put it in 1 nostril and you push. So it's pretty much peel, place, push. It's very simple to use. You wait 3 to 5 minutes. If there's no response, then you take out the 2nd dose and you do the same with the other nostril. By then, you've already given 2 doses. Approximately 5 to 7 minutes has passed. You've already called 911. So if those 2 doses don't work, you know that you have emergency medical system coming.
Where can people get Narcan?
Narcan, certainly you can get that at Lorain County Public Health. It's a state-run clinic, and it's funded by Ohio Department of Health as well. We're at 9880 Murray Ridge Road in Elyria. We're open from 8 to 4:30, and we do have evening appointments too. And the evening appointments, if you call and let us know you're coming, we'll make sure that you get a kit that day. Also in Lorain County, throughout Lorain County, there's a variety of pharmacies that participate in personally furnishing Narcan. So a lot of people can walk into the pharmacies and ask for Narcan, and they'll get 2 doses. Some of that is out-of-pocket costs. At our Project Dawn clinic, since it's funded by Ohio Department of Health, it is at no cost to our residents of Lorain County.
Are other groups behind the effort as well in terms of funding or organization?
Yes. One of the important pieces to remember is that Lorain County Public Health is just a partner with everyone else, right? And so the Ohio Department of Health, along with federal sources of money, along with, more importantly here in Lorain County, the ADDIS Board, the Alcohol Drug Addiction Services Board, has grant dollars to actually be able to help us for the Narcan itself. And even the hospital systems have actually donated Narcan for our kits. The part that we put in is the nurse's time to actually explain how to use it and exactly what to do to make sure that you use it properly. And so that's really what you get when you come to the clinic. We can actually take some time and really help you.
We've heard about opioids and overdoses for the past couple of years. The numbers spiked early on. They've come down, it seems, over the past year or so. Can you take us through that and sort of where we are today, especially here in Lorain County?
Yeah, so if you remember back in 2012, we had a big peak, and what happened was we started to triple the amount of overdoses that was happening here in Lorain County. It wasn't just in Lorain County, it was in neighboring counties and around the state. And so what happened was, at that time, we started to bring in Project Dawn and started to use Narcan and leveled off the amount of people that were dying. But then synthetic opioids came in. If you remember, fentanyl and carfentanil and these other really dangerous drugs came in, and again, we doubled. Luckily, at this point, we are starting to get a handle on it, and because of a lot of work like is being done here in Project Dawn, this year's numbers are lower, and we think, for the first time in many years, we're actually going to have a lower amount of deaths this year. So Project Dawn is one of the contributing factors, along with great police work and a lot of activities in the recovery community and a lot of combination of hard work that's really getting people to stop using opiates, and that's really the key.
How can people get more information about Project Dawn?
They can get more information about Project Dawn by calling Lorain County Public Health at 440-322-6367 and ask for somebody that works with the Project Dawn program. Or they can also get information at Ohio Department of Health. Just Google ODH Project Dawn.
Very good. This has been First Response, a project of the Alcohol and Drug Addiction Services Board. Thanks to Lorain County Health Commissioner Dave Koval and Lorain County Public Health Nursing Supervisor Pam Weiland. And behind the camera, Bruce Bishop of the Chronicle Telegram.